Hello and welcome. My name is John Hertig, and I have shared a short summary of my professional background at the end of these slides. The title of this presentation is Introducing Meaningful Change. The financial relationship disclosure for this presentation. These are the learning objectives that will be addressed during this presentation. These are the key abbreviations that will be used during this presentation. At the end of the presentation, we'll come back to the self-assessment question. But for now, let me read it. To successfully lead and manage change, a medication safety leader must purposefully alter and expand the current mindset in which both individuals and an organization operate. A, true, or B, false. By way of an introduction, it's very important that as we think about change management and defining successful change management, that we understand and level set what that really means. And so often, what we think about or see in terms of success is just this beautiful linear upward line. And that's really not what success is. Success is a tricky, convoluted path that much more resembles this arrow to the right. So think about this image when we're thinking about change management. It's not always clean and clear, but can be a little bit messy. Ultimately, though, we're heading in this upward trajectory towards success. Likely no surprise to you that we face so many challenges in a contemporary healthcare system. And I've distilled these down into really three key buckets, from spending to access to quality. Within these buckets, let's go into a few of these issues and challenges in a little bit more detail. Unfortunately, too many people in our modern healthcare system lack health coverage and basic access to care. Oftentimes, our systems focus on treatment and treating a problem rather than preventing that problem in the first place. I mentioned access issues, and access issues come in many shapes and sizes, from geographic access to economic access to bias and stigma and other health disparities that really do negatively influence one's ability to access care. Oftentimes, we're working in a very inefficient delivery and payment system, and that leads us to this US healthcare spending issue where really it is unsustainable. We spend a lot of money on healthcare in the United States, but we don't always rank very high when it comes to health outcomes. Given the number of healthcare challenges, it's very complex being a healthcare leader today. We have more patients, representing an increased demand for the services that we provide, including pharmacy-related services. Payment is increasingly tied to performance, which does make sense. The better we do, the more appropriately we're paid, but this all functions in very complex care models. Pharmacy and healthcare is highly regulated, and that's not going away, where we have many regulatory changes reflecting rules or laws or other important information that we need to be in compliance with. This doesn't happen in a vacuum, though. There are a number of social and economic changes that are always happening, including cost effectiveness, how we improve access to care, and how do we ethically provide care to ever changing populations. Ultimately, as a healthcare leader, we need to rise to this challenge that's currently in the US healthcare system to make sure that we're improving quality and cost effective care. Foundationally and fundamentally, though, safety, patient safety, medication safety remains an unchanging human right. So, despite the complexity, we need to make sure that the care that we provide is always safe. Primum non nocere, first do no harm. And that's ultimately why patient safety and medication safety is so incredibly foundational to what we're doing as healthcare leaders. Saw on our previous slide. So how do we do that? Well, we need to make sure that we're integrating safety into strategy. Safety and patient safety and medication safety needs to be a foundational component of our organizations. And there's some great quotes here. One is leadership is the critical element in a successful patient safety program and is not or non-delegable. meaning that we can't just delegate it away. Another great quote, if safety is to be seen as a strategic priority for all staff, then leadership must make it a key focus. If our leaders aren't making safety a priority, then our staff and our culture will not also then make it a priority as well. So integrating safety into strategy is essential. And as we do that, making sure that it's a continuously revised strategic plan for safety, that we're always looking at this and trying to improve our safety plan and how we integrate safety into strategy. What this helps us do then from a change management standpoint is guide that transition from where we are today in terms to where we want to be as a target state. And that gap is where leaders can really help bridge in terms of great strategy, getting us from current state to target state, which in this case is a more safe organization. Leadership and change management skills are absolutely needed to help bridge that gap from current to target state. It's all about the delta, all about the change, all about making sure that we're managing that throughout the process. Healthcare leaders, so much to do and so little time, right? So as we're developing our medication safety strategic plan, it's helpful to have some good places to start. And fortunately, we have a number of really good places where we can begin. One is the Standardized for Safety initiative, which is really important. We can lean on other organizations like the Institute for Safe Medication Practices, or ISMP, who puts out a targeted medication safety best practices for hospitals list routinely. ISMP also offers many, many great self-assessments for organizations to help us identify where our risks are, and then we can target and focus on those risks. ASHP has a number of great resources, including guidelines on preventing medication errors in hospitals, which represents an excellent place to start as we incorporate safety into our strategic plans. When talking about change management and strategy, particularly as part of a medication safety plan, it's all about alignment. Align, align, align. And the more alignment we have with our organization's strategic objectives or goals, the better off we're going to be, not only in terms of clarity of plan, but also being able to sell that plan and resource that plan appropriately. So we have our organization's strategic objectives at the top. What are those imperatives? What are those absolute musts? And then to accomplish those objectives, our organization then sets goals. Our medication safety and quality strategies plan then needs to be aligned with those goals, always viewing through the lens of safety science, meaning how are we taking advantage of a culture of safety? How do we make sure that we're always looking for constant improvement or continuous quality improvement? These basic principles can really help us align to prioritize for impact. Ourselves and our colleagues need a roadmap to follow if we're going to change. And that's where strategic planning is absolutely essential. How do we develop our strategic plan, our roadmap to help guide change management? The process of strategic planning is really essential because what it does is it helps the department of pharmacy or any department focus on a set of goals, which again are aligned with the organizational goals. It then decreases the amount of time spent on other activities that maybe are unnecessary or of lower priority. Medication safety strategic plans, as we talked about, should align. The framework and foundations of a healthcare organization strategic plans include a number of different stakeholders and factors. Certainly putting the patient first and that customer satisfaction first is essential. Why do we operate? What is the mission of our organization? It's to care for our patients. But no margin, no mission, meaning if we don't make some money, we can't then care for patients. So there are also financial foundations and objectives. We need to operationalize our plan. So our operational objectives, we have the people, the actual people who are working with us, ourselves, our colleagues, the people part of the organization is incredibly important. And then what is our growth timeline? How are we going to grow? In what service areas? How are we going to take care of more patients, different patients, as we look forward to the future? When we look at strategic planning, there is an average timeline of between 3 and 5 years, but plans need to be relevant. So plans should always be reviewed or updated at least once a year, at least annually, if not more frequently. Given the importance of a strategic plan as a pathway to change and growth, it's important to know that as we build our solid strategic plan, that it's factual. It's based in as much knowledge and facts that we have at a particular time. Now, we can't always predict the future, and we're not always going to be right, but we need to be factual as we build that strategic plan. What do we know right now to help us inform what we might see in the future? To help guide us in our path, we need to be very goal focused. And those goals, again, should align with the broader organization goals. And they should be broad. Just doing what we've always done is not a great strategic plan. Let's think bigger, let's think broader, and let's make sure we build that bridge from current to target or future state. Process of strategic planning is not unlike the model for improvement or plan, do, study, act model. So what we do when we're strategic planning is we have to start with the design of the plan. That's developing the plan. What does it look like? What's the structure? Where are the focus areas? Is it financially driven, operationally driven? Multiple stakeholders have to be involved. This is a nothing about me without me situation where we have lots of input in the design of a strategic plan. And then we do it just like our plan, do, study, act. We do it, we implement the plan, typically over the course of multiple years so that we can actually see demonstrable change. And as we're implementing that plan, we're studying it, right? We're tracking it, we're measuring success. We've included markers and measures of that success and making sure we're hitting our goals. And if we're not, then we review and we alter appropriately. And then based on the success of the plan, we act. So very, very similar in mimicking those steps of the model for improvement. Dive into these steps in developing a strategic plan in a little bit more detail and start with designing the plan. As I mentioned, designing is all about including stakeholders and putting pen to paper. So we're going to create or improve our mission and vision statement. And remember, the mission is a reason for existence. It's why we exist. Our vision is our visionary goal for the future. A vision basically is once achieved, our organization is no longer necessary. So if our organization's goal is to make sure everybody has a place to live, once everybody has a place to live, then we no longer need to exist. Our mission is how do we then execute on that vision? When we're designing the plan, we're going to use broad goals and specific objectives that have to be attainable. They need to be measurable, they need to be attainable, reachable, and you're going to incorporate information from a lot of different sources, including gap analyses that were conducted. Maybe you even use the ISMP tool. An FMEA, which is a failure modes in effects analysis, which we're not getting into great detail, but essentially these are just sources of information that will build into our plan. We need to recognize the impact on departments, otherwise known as burning platforms. So burning platforms is what gets different departments or groups fired up. What are their pain or pressure points? Let's make sure that we're not increasing pain, but rather than decreasing pain and decreasing that pressure. We need to understand and have a good sense of what are those various costs. There's the human costs. So what's the impact on the patient? What's the impact on our staff or the family? Certainly the financial costs, but also reputational costs. What are the costs to our organizational reputation, which is the hardest thing to gain, but the easiest thing to lose? Nothing about me without me, meaning as we're designing our plan, we have to have our key stakeholders providing input. And not all comments can be addressed, but everybody should have a chance to comment. And then we're going to put pen to paper, make it official, document the plan so that it can then be implemented. After designing the plan, then we move on to making it reality and implementing that plan. Like any good project management, we want to make sure that we have a really clear implementation schedule that's established and communicated. Make the plan understandable to everyone. Post it publicly, make it accessible. How can we have people engaged in a plan if they don't know what the plan is? So everyone needs to see it and it needs to be quite visible. And that leads us to communication, explaining why and how our plan will impact the organization and specifically the people within it. Establish how you're going to move the plan forward. What are those implementation steps? And then what are also those measures of success to know that we're positively implementing the plan, and then cascade it. Translate that plan throughout the whole organization, which then links back to making sure it's clear and communicated effectively. Brings us to tracking our progress, where we're going to review our strategic plan on a regular basis, focusing on measuring how we are doing on goal progression. Now, it's important that when we're using a strategic plan, that we're using a working strategic plan, one that is operational and adaptable. It's not just about creating a plan and hanging it on the wall and admiring it. It's one that you have to put to work, that uses time-sensitive metrics and that ensures monitoring the impact of any initiative that's part of that strategic plan. As discussed, we want to be very clear and transparent with all communication and information. Tools that can be incredibly helpful include dashboards, which is a collection of like information. Think about like a dashboard on a car where you have a speedometer, an odometer, and a gas gauge, where you have this disparate information that comes together to help you use and drive the car. Or what's called a balanced scorecard like from a basketball game or a baseball game that's keeping track of our performance, which can then be used to monitor and communicate results. I recreate the wheel. Really, there are so many great resources out there that can feed into our strategic plans. And here's a listing of some really helpful web resources. The American Society of Health System Pharmacists, ASHP, has a number of good resources, as previously mentioned. The Institute for Safe Medication Practices, ISMP, also does as well. The Joint Commission, or TJC, their website is here and can provide some helpful information, along with IHI, the Institute for Healthcare Improvement, and finally, the Agency for Healthcare Research and Quality. I encourage you to explore each one of these websites and see what they have to offer for your own medication safety strategic plan. Execution and implementation of a plan can be the hardest thing that we do as leaders, is actually using that plan to drive change. And unfortunately, along that change management execution journey, there are a number of challenges that we can encounter. And here's a listing of a few of these. One is just a failure to prioritize. There are so many priorities that we have in healthcare, but we have to prioritize absolutely safety, but then prioritize the successful implementation of our plan. And that means aligning key stakeholders and decision makers, communicating effectively, and making sure that we're tracking success. Now, culture eats process for lunch. It's one of my favorite patient safety quotes. Culture eats process for lunch. If you don't have a culture of safety, if you don't have a culture of collaboration and innovation that's willing to accept change, it's going to be very hard to then successfully implement your strategic plan. Focusing on culture first is an absolute must as a foundation. And the inability to identify a fail-safe solution, meaning you haven't proposed solutions that are resilient to failure. And that's really important. And that speaks to the alignment with organizational goals and objectives, and the inability to hardwire those solutions. Finally, navigating change management can be very tough. You could have all these bits and pieces in place, but ineffective change management can be an incredible challenge in terms of implementation and execution. So we're going to dive into change management here next. As medication and patient safety leaders, initiating and managing change can be one of the most difficult responsibilities that we have. And it really does require the altering and expanding of a mindset in which the individual and an organization operates. You have to really create what's called an impetus to transform, otherwise known as maybe a burning platform. And perhaps you've used that term before, but where it comes from is actually a little fascinating. There's this story where an oil rig or an oil platform was on fire in the Atlantic Ocean. And if you know anything about oil rigs and platforms out in the ocean, there's not a whole lot of escape options. And so you have this burning or on fire platform, and you have one of the oil workers that's at the edge of the platform, which are very high off the ocean. And this individual in this story has a choice to make. He can either succumb to the flames and pretty much certain death, or he can take a leap of faith off of this platform. And in this story, he takes a leap of faith, ends up in the ocean and is rescued and lives. And so the term burning platform is then adopted or adapted to say we need to create something that's so hot that's so on fire, that is so motivating that we get people to jump with us. And so when we think about this from a change management standpoint, we have to create this mindset that includes the right attitude, clear perspective, providing evidence-based rationale, and really using iterative processes based in logic to drive change and making sure that everybody is not only clear on the change, but accountable for that change. Any change that we manage needs to be aligned to achieve consistency of organizational goals and associated resource allocations that are, again, aligned with strategic plan and then leadership commitment. You have to have leadership on board. When I talk about successful strategic planning, it starts with a great culture, a supportive culture, and is bookend by a great set of leaders, supportive leadership. It's the bookend between culture and leadership. There are so many philosophies on change management, and we're certainly not going to review them all in this presentation. There are great books out there. But I want to highlight two techniques or two philosophies that I feel are really helpful as I manage change. One of those is Kotter's 8 steps of change, and the other is this idea of diffusion of innovation. Dr. John Kotter's 8 steps of change, which are laid out in a really fun book called Our Iceberg is Melting. And I love this book because one is it's become a little bit of a manifesto on change management for me, but also it involves penguins. And in this fable, these penguins, there's a subset of these penguins on their iceberg, and they discover that their iceberg is melting. What they have to do, though, is convince the elders of the colony that their iceberg is melting so that there can be some action taken. Does this sound familiar as a patient safety or a medication safety leader? As we know there's a problem and we have to convince others that this problem is worth action. So in this fable, Our Iceberg is Melting, there are 8 steps that this penguin colony goes through, from creating that sense of urgency or that burning platform, building a guiding coalition of support, forming that strategic plan and vision, enlisting a volunteer army to then implement that plan, enabling action, creating short-term wins as you go through the implementation of the plan, getting that acceleration through the plan and sustaining it, and then finally instituting sustainable change. Into Kotter's approach in a little bit more detail, and starting with this idea of creating urgency. To create urgency, we have to be honest and truthful about the gaps in our particular processes and the weaknesses that we experience. So we have to talk openly so that people understand that something does need to change. And oftentimes, storytelling can be our greatest asset here, telling stories about patient safety issues and problems. We want to communicate about our plan for the future and how things can get better. This is the idea of very clearly articulating this is the current state we're in that's broken. We need to get to this target state in the future. So let's create that urgency and focus on making progress. Once we do that, we're going to build our coalition, our team, our support, because we can't accomplish this grand task alone. And we need those different points of view. We need different experiences, opinions, and knowledge. You need to have a group that's large enough to have credibility, where it's diverse, but not so big where you're not making any progress and you're not driving the process of change. We've already talked a little bit about the development and communication of a vision, and you can't communicate a vision without your plan, without your path forward, and that's why having that strategic safety plan is so important. It really needs to be clear, simple, transparent, so that people understand it and are motivated by it. What that does is create that strategy for achievement, and then that strategy can be repeated. Always keep it in conversation. You cannot over communicate a vision. Email, town hall meetings, one-on-one sidebars, keep it part of the conversation and a standing agenda item on all meetings. It is a team effort. You have to collaborate, communicate, and then coordinate, and then repeat, collaborate, communicate, and coordinate when it comes to communicating a vision. Nobody accomplishes great change in isolation, which is why we have to enlist our volunteer army to help enable action. Now, medication safety leadership is a little unique in that we have quite a bit of responsibility. responsibility in terms of preventing harm, responsibility in terms of identifying issues and leading change. But we often don't have huge teams to do that. We have limited authority. So what we do then is recruit disciples to enable that change. Now, meanwhile, organizational structure can help with that or prevent that. Do we have the right people in place? Do we have the right lines of communication? Do we have a hierarchy that's unnecessary? Do we have open dialogue? It kind of harkens back to culture, but what it also does is kind of start this conversation around practice model optimization, making sure that we're using our vast resources within our organization to their utmost use. For example, utilizing pharmacy technicians to make more time for pharmacists to then work more clinically or patient focused. Also, we need to make sure our pharmacists have time to problem solve. So are we setting ourselves up for success when we talk about structure of our army to really help enable that needed action? Potter's steps lead us to these final few, which is all about generating short-term wins, sustainability, and then making it stick. Big changes do not happen overnight typically. They do take time. What we need, though, is to keep moving forward by showing positive results. Transparency and data are essential. Keep people motivated by showing improvement, that their work, their important contributions are making the change for the better. Start small and then build and produce more change. There's this great idea where it's called a small test of change. And oftentimes the PDSA cycle, plan, do, study, act cycle, is used to visually demonstrate this, where every turn of that plan, do, study, act cycle, those small tests of change build on themselves with upward momentum and trajectory. You can think back to that initial slide with that line going upwards and upwards towards success. That doesn't happen overnight, and it doesn't happen without pitfalls and challenges, but we do start small, we build and we produce more change. It requires us as leaders in this space to be relentless. Fight the resistance, be data-driven, be transparent, and make sure that we're turning that vision that we've clearly communicated into reality, closing that gap from current to target state. We're going to employ then also this idea of diffusion of innovation principles, which is what we're going to talk about on the next slide. Innovation diffuses in healthcare just like any other organization. And in healthcare, invention is hard, but dissemination is even harder. This idea of diffusion of innovation explains how ideas are then spread and sustained. And there's a great book by Everett Rogers called Diffusions of Innovations. And in this book, there are three basic clusters that correlate with the spread of innovation. Perceptions of the innovation itself, the characteristics of the people who then adopt that innovation, and then contextual factors. And we're going to explore these in greater detail on the upcoming slides. Begin with the perception of an innovation and the role perception plays in diffusion. People are going to perceive the innovation using a few different factors, include what relative advantage is this idea over the current state? So what advantage do I see? Is my role or my group compatible with this? Does it fit into what I'm currently doing, or does it feel insecure or challenging? How complex is it to implement? People generally gravitate towards making the easy way the right way and the simple way the right way. Complexity can be really hard for individuals to successfully implement. Do I have the ability to try it and to learn it? And then do I get to observe how successful it is? Do I get to see how successful it is in the environment? And that's going to contribute to my relative perception of, is this the right thing for me to do as that diffusion of innovation rolls out. Building on the previous slide, these are some more details around the perception considerations when we look at diffusion of innovation. In terms of relative advantage, as discussed, is it better than previous ideas? And what benefit do I see? In terms of compatibility, is it consistent with my current values and beliefs? Does it fit into the social norm and the process norms that I currently practice in? How hard is it to understand? Making the easy way the right way is always a winner when it comes to diffusion of innovation. Is it easy to test? Is it easy to try? Can it be implemented in installments or is it all at once? And then finally, it's that observability. Do I get to feel and see that the innovation is occurring? And can those results then motivate me to continue to diffuse that innovation? There's lots of science and study around the process of adoption. How long does adoption occur? What does it look like? And the science will tell us that the process of diffusion of innovation follows a pretty typical S-shaped curve, which is then converted to a statistical bell-shaped curve. In the beginning, in one edge, we have the innovators. These are the cutting edge, venturesome, risk-taking individuals that are first to adopt. They're the ones in line at the iPhone store or whatever to get the first technology as soon as it comes out. Then we have the early adopters after the innovators. These are the opinion leaders. They're well connected. They can be elected, but they kind of know what's going on. They have their finger on the pulse. Once the innovators and early adopters occur, then we have this idea that there's a chasm that needs to be bridged. And once that chasm is bridged, where we convince enough people that it's worth adopting, then we have this idea of early and late majority. These majorities occur at least early from a local perspective and because they're familiar with the product, and then late because now everyone else is doing it, so they feel the peer pressure. It's the status quo, so they're going to do it. So between early adopters and early majority, we have this chasm once crossed. It kind of is a tidal wave of adoption. We're always going to have laggards at the end. These people are isolated, suspicious. They may still not have a smartphone because they don't trust it. Innovators and early adopters, they help get the word out. Once they get the word out, they propagate to opinion leaders. You cross the chasm. You have the vast majority of early and late adopters, and then a saturation point is eventually reached. And this is scientifically proven. We see it with technology. We see it with ideas. Anything. There are environmental and contextual factors that influence the rate of diffusion of innovation. How well was it communicated? Was it clear? We know we need to do it, but knowing you need to do it and doing it can be vastly different. So communication is super important when it comes to this. As discussed, leadership and culture are very important as well. And so having good, solid leadership built on a foundation of a good, solid culture is definitely going to help with diffusion of innovation. But anytime that we innovate, anytime we change, we need to manage that change appropriately. So good management will help with diffusion of innovation. Poor management will certainly slow things down. And then me, as someone who's looking at actually changing, what incentives do I have to do so? Are the incentives that are built into any change management plan aligned so much that I feel like I have a voice in the change and also I am incentivized to do so? These provide important contextual factors that contribute to how quickly innovation is diffused. Brings us to our self-assessment question. As a reminder, our self-assessment question is: to successfully lead and manage change, a medication safety leader must purposefully alter and expand the current mindset in which both individuals and the organization operate. Your choices are A, true, or B, false. The answer to our self-assessment question is A, true. Absolutely. To successfully lead and manage change, a medication safety leader must be very thoughtful, data-driven, be a clear communicator, and very purposefully alter and expand the current mindset for both individuals that are helping with change, but also the organization within which change is occurring. So again, the answer is true. Conclusion, as we close out this module, remember, leading practice forward towards safer systems is everyone's responsibility. Leading and managing change is inevitable and critical to success. We need to build and implement a medication safety plan that aligns with an organization's strategic plan. Alignment, alignment, alignment. The inclusion of safety in an organization's strategic plan demonstrates that it is a priority, and it helps facilitate leadership commitment to safety initiatives. Additionally, by aligning medication safety with strategic goals, resources will then be hopefully allocated, for these very important safety initiatives. It makes it more easily justifiable when resources are necessary to meet those goals. There are lots of different change management philosophies out there. The ones that I particularly pointed out were Kotter's 8 Steps of Change and the Diffusion of Innovation. I encourage you to explore these more on your own. 2 slides reflect the references used to develop this presentation. Thank you very much for your time and attention.